Total praise on Hope FM. Listen and leave. Welcome to this hour here on Breath of Heaven. Yes, and at the very beginning, yes, thinking about matters health, matters to do with the health of our bones. Very, very vital. And I had put up a post there regarding what we'll be discussing tonight. Has to do with the feet and ankles. At some point or the other, we find ourselves having such kind of a condition. What causes that? We'll be talking about that. But in the meantime, let me invite Daktari to let us know how he has been. And tonight, I have the honor and privilege of hosting Dr. Brian Maluki from AICQ International in Kijabe. Welcome to the studio.
Thank you, Jackson.
How have you been?
I'm fine, thank you. Glad to be here again. And it's a blessing to be here and to be hard on the airwaves, to share some insights here and there. Yeah.
Yeah, welcome. I think the last time you were here was last year, if I'm not wrong.
Sure.
And the conversation was really good, and so we are glad to have you back. And
Thank you.
yes, as I alluded to tonight, we just want to have an understanding of swollen ankles and feet. Somebody may find himself or herself in that state and wondering what's happening to me. And so we'll just start from the very beginning so that one can be able to understand and know what are the causes, what are the major causes of swollen ankles and feet.
So there are quite a number of causes. And maybe just to begin, it's to understand that the ankle joint is one of the major joints in the body. It's a weight bearing, or what carries the body weight, and it helps you move from one point to the other. Same function as the hip joint and other major joints like the shoulder joints, the hip joints, and the knee joints. So it also takes a big concern, it's quite has a huge role in terms of a person's mobility, and that is second to maybe the hip and the knee joints in terms of how much of function in regards to mobility and carrying you from point one to point two, and that's what makes the ankle joint quite key joint to look at in terms of its function, care, and also and care encompasses both preventing and also addressing the issues that face the ankle joint. As you always say, it's a complex hinged joint with quite a number of motions around it, which is in several planes. One, the frontal plane, and the side plane, what we call the sagittal and the coronal. And there are three bones involved in the ankle joint. The ankle joint is formed by the tibia and also the bone that we call the talus. It forms somewhat like a ball and socket. And also there is now the fibula that stabilizes the ankle joint. And now the foot, it's such a small but also a complex organ with almost like 26 bones and over 100 ligaments. So it's quite a complex. So some of the things that can cause swelling are anything that will lead to alteration in the normal anatomy, or how those bones they are formed, or how they should relate with one another. So things from all the way from things that are related to deformity that one is born with, either clubfoot. I think many people know about clubfoot. Other things. when you're born with an abnormal foot, the people are born with too many toes. The other thing is injuries, either sport-related or non-sport-related or accidental injuries. Either you hurt your foot in a car accident or a motorbike accident or a road bike accident. The other issues is that we have inflammatory processes that are related either to an underlying either infection or systemic problem, like or inflammatory, like what we call diabetes, some generalized body inflammatory processes like what we call SLEs and so forth. The others could be what we call neurogenic causes. Neurogenic causes are, there are some people who are, for some reason, they lose sensation in their lower limbs, either as a result of, again, trauma, paralysis like polio and so forth. And there's also some either vascular issues, you have reduced blood flow to your foot and so forth. And the other thing would be related to disuse or overuse. People who stand a lot, running, or some people who just don't at all work out as appropriately. And this goes hand in hand with poor foot care and footwear. Those go hand in hand together. Yeah, so there are quite a number of causes. Yeah, and the other thing is that I won't forget is when you have overloading of the joints, and in such a case like overweight or improper loading and also offloading, which again relates to how you care for your foot and the kind of footwear that you use. So there's some people who will, if you don't wear the correct shoes, there are people who get at the end of the day, like you've gone for work and all that, or run or walk, the people complain of pain and swelling because of abnormal footwear. Yeah, that's also a contributory factor.
Can we categorize these kind of swelling to be chronic and temporary? If so, what would be considered to be chronic swelling and temporary swelling?
Temporary swelling is something that comes for a few hours, then goes, and maybe comes again and goes. But when you look at chronic, it's something that will be there for anything that persists more than like maybe for 4 weeks or 6 weeks. Thereabout, you call that, now we are getting into the chronic swelling. In between, from week, 2 weeks, that's acute. 2 weeks now all the way to 4 weeks, we call it subacute. And then we can have acute on chronic. You have a period whereby you had chronic symptoms, then you got relief, then again you have acute symptoms. Again, that also can be, we can categorize that. And each of those has different causes, but again, causes in the acute are usually things that are temporal. You get a small sprain, maybe you're walking. You see, sprain is what commonly people call, quote unquote, in Swahili, kuteguka. Kuteguka, then I was okay, but I have this pain, nagging pain, then it comes and goes away. But if you have recurrent insult, that sprain can lead now to chronic. And chronic means there is some abnormality that has occurred in your foot or in your joint, causing a permanent deformity or permanent insult in the joint. Yeah, which, I mean, if you try painkillers or elevating, as we say, or rest, doesn't bring down the swelling or the pain.
In terms of age, probably weight and lifestyle, what would you say highly contributes to having swollen ankles and feet?
One, it'll be in the past, you would say it's age, because age correlates with the duration your joints have been under stress. Same case as you'd correlate it with a car, the brakes or the tire, wear and tear. The more the mileage of a car, the more the brakes or the tires have been exposed to wear and tear. So in the past, that was mostly, that would have been the correlation. But now, with the issues of lifestyle and degenerative and overweight, the mileage does not correlate to the degeneration. Because according to what we call the ankle and foot biomechanics, when you're walking on even ground, the ankle joint absorbs up to 2 times of your body weight. So that's the amount of stress on your ankle joint. And when you're running it almost gets to about 5 times of your body weight. So if you're 50 kgs, if you're walking, the stress on your ankle joint is about up to 100 kgs. That's the amount of stress on that joint. If you're running, then it becomes up to 5 times more. So what happens? If you get overweight, it increases the stress around the joint, and it means the mileage of that joint, before you start having issues, the lifespan is shorter. So you tend to have these symptoms like pain, arthritis earlier. But you see, in the past, because you're not overweight and kind of activities, sedentary lifestyle, allowed you to use your joints for quite a long time before you start having these issues we call osteoarthritis, the wear and tear. So that is the correlation. Yeah.
Right. Thank you, Dr. Tonight we have Dr. Maluki, who is helping us get insights regarding swollen feet and ankles, what that is all about. And your questions and comments, feel free to share with us on SMS line 20933, on WhatsApp 0717 400 555. I'll be getting to them in a little while.
Hi, this is Carol from the Celebration Choir.
Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your #1 Christian radio station, offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups: children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild, out-of-the-box ideas, committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements. And we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media. We keep hope alive. Welcome to the world of Hope Media.
Rafiki soul is a promise of a hand that reaches and goes beyond what angaza tumaini kote. I'm forever grateful. Ninashukuru ukarimu, ukarimu. I'm forever grateful. Ninashukuru ukarimu, ukarimu. Rafiki soul is a promise of a hand that reaches and goes beyond watangaza tumaini kote. I'm forever grateful. Ninashukuru ukarimu, ukarimu. I'm forever grateful. Ninashukuru ukarimu, ukarimu. Rafiki soul.
Friends of Hope, keeping hope alive.
Rafiki soul is a promise of a hand that reaches and goes beyond watangaza tumaini kote. I'm forever grateful. Ninashukuru ukarimu, ukarimu. I'm forever grateful. Ninashukuru ukarimu, ukarimu. Rafiki soul is a promise of a hand that reaches and goes beyond watangaza tumaini kote. I'm forever grateful. Ninashukuru ukarimu, ukarimu. I'm forever grateful. Ninashukuru ukarimu, ukarimu.
Friends of Hope, keeping hope alive. Men on Record.
Do your children know that you love them? Not by what you buy for them. Do they hear it from you? Emotional abuse. It's a silent killer that we don't talk about. Asking yourself those very relevant questions. What kind of father do I want to be? When I'm getting married, what kind of husband do I want to be?
It's a conversation about men for men.
And remember this.
To revisit, reveal, and heal issues among men.
Good evening, Men on Record. Why should I talk or say much when all I want is peace, not problems?
Let's set the record straight. Men on Record, Fridays at 7 p.m. live, exclusively on Hope TV and Hope FM. Men on Record, it's a man thing. Men on Record.
Do your children know that you love them? Not by what you buy for them. Do they hear it from you? Emotional abuse. It's a silent killer that we don't talk about. Asking yourself those very relevant questions. What kind of father do I want to be? When I'm getting married, what kind of husband do I want to be?
It's a conversation about men for men.
And remember this.
To revisit, reveal, and heal issues among men.
Good evening, Men on Record. Why should I talk or say much when all I want is peace, not problems?
Let's set the record straight. Men on Record, Fridays at 7 p.m. live, exclusively on Hope TV and Hope FM. Men on Record, it's a man thing. Men on Record.
Do your children know that you love them? Not by what you buy for them. Do they hear it from you? Emotional abuse. It's a silent killer that we don't talk about. Asking yourself those very relevant questions. What kind of father do I want to be? When I'm getting married, what kind of husband do I want to be?
It's a conversation about men for men.
And remember this.
To revisit, reveal, and heal issues among men.
Good evening, Men on Record. Why should I talk or say much when all I want is peace, not problems?
Let's set the record straight. Men on Record, Fridays at 7 p.m. live, exclusively on Hope TV and Hope FM. Men on Record, it's a man thing. Men on Record.
Do your children know that you love them? Not by what you buy for them. Do they hear it from you? Emotional abuse. It's a silent killer that we don't talk about. Asking yourself those very relevant questions. What kind of father do I want to be? When I'm getting married, what kind of husband do I want to be?
It's a conversation about men for men.
And remember this.
To revisit, reveal, and heal issues among men.
Good evening, Men on Record. Why should I talk or say much when all I want is peace, not problems?
Let's set the record straight. Men on Record, Fridays at 7 p.m. live, exclusively on Hope TV and Hope FM. Men on Record, it's a man thing. Men on Record.
Do your children know that you love them? Not by what you buy for them. Do they hear it from you? Emotional abuse. It's a silent killer that we don't talk about. Asking yourself those very relevant questions. What kind of father do I want to be? When I'm getting married, what kind of husband do I want to be?
It's a conversation about men for men.
And remember this.
To revisit, reveal, and heal issues among men.
Good evening, Men on Record. Why should I talk or say much when all I want is peace, not problems?
Let's set the record straight. Men on Record, Fridays at 7 p.m. live, exclusively on Hope TV and Hope FM. Men on Record, it's a man thing. Men on Record.
Do your children know that you love them? Not by what you buy for them. Do they hear it from you? Emotional abuse. It's a silent killer that we don't talk about. Asking yourself those very relevant questions. What kind of father do I want to be?
Yeah.
When I'm getting married, what kind of husband do I want to be?
It's a conversation about men for men.
And remember this.
To revisit, reveal, and heal issues among men.
Good evening, Men on Record. Why should I talk or say much when all I want is peace, not problems?
Let's set the record straight. Men on Record, Fridays at 7 p.m. live, exclusively on Hope TV and Hope FM. Men on Record. Join John Carson every weekday as he takes us on a journey through the Bible.
Whoever shall seek to save his life, if you go back to living for yourself, you're going to lose it. But whoever shall lose his life, give up his life for my sake, he shall preserve it.
Enjoy interesting, knowledge-packed, yet simple teachings through his humor and in-depth understanding of God's Word.
The last people that tried to put God in a box, literally, he rose again. He wouldn't stay in their compartment. If God was small enough for me to figure out, he wouldn't be big enough for me to worship.
Tune in to Hope TV for John Carson every 10 p.m., 4 a.m., and 10 a.m. weekdays on Hope TV, where you look and live.
And helping us with insights regarding what we ought to do in case we find ourselves there, or somebody that you know, how the steps that you need to take and how you're going to deal with it. Dr. Maluki is with us tonight to look at that. And so I invite you to keep sending your questions to 20933. That's the SMS line. On WhatsApp 0717400555. We'll look at the questions a little later on. And so, Dr. I think we have gotten to that point of looking at the factors like age, weight, and lifestyle, how they contribute to this issue. And so let's move to another area, and that is looking at the whole scenario. At what point then should one seek help? When they're experiencing such pains of their ankles, or rather swelling of their ankles and feet, at what point should one now seek medical attention?
I would say if you have pain that is functional limiting, that is interfering with your day-to-day activities, you can't walk normally for the same amount of time or the distance that you've been walking, then you need to seek medical attention in the acute, especially in the acute setting. And of course, if it's an high energy trauma, like you're involved in an accident or you sprained, and you have noted that at that point in time you cannot put your foot on the ground, you can no longer walk, then you need urgent medical attention. If there is an accompanying deformity, that the way your foot and your ankle is always aligned, because of whatever injury or whatever underlying condition, it is now assuming an abnormal position, then you need to seek urgent medical attention. In the chronic setting, I would suggest by all means always get to know what is the cause of whatever issue that has been there. There is any chronic symptoms, we need to investigate and know what is the underlying pathology. Then the other thing is that any sort of, even if you have an abnormality in your foot or your ankle, which is not painful, but it alters how you walk, then you need it to be addressed. Because what happens is that any deformity ultimately always will lead to pain. We have, not a very pleasing health-seeking behavior. We are always prompted to seek medical attention when there is pain and we can't function. But what we don't realize is that if you have something that is not normal and it's not painful, with time it will. If there's some people who have an abnormal looking feet, either on the toes, either on how the alignment of the ankle with the heel is. The people who can have just a complaint like, my shoe does not wear out evenly. I find some, either the inside of the shoe or the outside of the shoe, the sole wears out faster, or they have abnormal shape of the foot. What happens after some time, because it alters how your energy transmission on your feet, ultimately that will reflect inside your foot or your bone, and it will lead either to recurrent sprains, accelerate the wear and tear, and you will have pain, you will have functional limitation. Then you need to, if you have all those, then you need it to be addressed. There are people who have insensate or reduced sensation to their feet. This can be due to either some systemic conditions like diabetes, or just some sort of neurologic condition that reduces the sensation to your feet. Then you need that to be addressed, both from an orthopedic point of view and from a physician point of view. Because what happens if you have reduced sensation in your feet, it predisposes you to frequent injuries, and now that will make the situation complex, because once you get injury, you have all these chronic wounds, and it becomes a very complex problem to deal with. But once you realize you have any abnormality on your foot, abnormal sensations on your foot that you can't explain, then you need that to be addressed. And any amount of trauma that limits your function needs to be addressed, and any chronic symptoms. Yes.
So, Doctor, what are the treatment options available once you have taken the diagnosis and all?
The treatment is a whole spectrum, from just conservative, or what we say is non-operative, and operative management, speaking from a surgeon's point of view. When it comes to conservative management, in the setting of acute injuries or trauma, we can talk about what we call rest, ice, and compression and elevation. That mnemonic we call RICE, whereby we mean if you have swollen feet that are painful, you need to rest, you need to take some anti-inflammatory, some ice compression, because of what happens in the setting of an acute injury. There's a lot of inflammation, we need to control that. Part of the other conservative management is even bracing, whereby you can put on like a splint, like something like an ankle support brace, just to help with just minimizing the pain and helping restore your foot biomechanics, and again also the rest part of it. The other part would be the medication part of the issue, and now treating the underlying problem, if it's get diabetes, gout, any form of systemic inflammatory that is causing the swelling, has to be controlled medically. And the other part is there are some conditions that are related to abnormal foot biomechanics, either related to abnormal, either like a foot deformity that has been there, flat foot, clubfoot. Those ones can be, depending on the severity of the deformity, can be treated. There's also a role of conservative management that is non-operative. Things like hallux valgus, whereby your big toe is deviated towards the outside of the foot, then which causes a lot of pain when you wear tight-fitting shoes, and also things that we call bunion, swellings around the part that connects the midfoot and the toes. So change of shoe wear will come in handy. Things like painful heel syndrome, like plantar fasciitis and all that. Things like getting the appropriate shoe wear, increasing the cushioning of the shoe, part of the conservative management. So it's quite a wide spectrum depending on the diagnosis you're dealing with. Now, when it comes to operative management, can include correcting the deformities. We do a lot of clubfoot corrections for children and even for adults, correct post-traumatic deformities that can happen. We do that, we can correct that, so that we just restore how the foot should anatomically be or functionally be. And could also include injecting some steroid, especially in the joint, because of the chronic inflammation. And when the ankle joint, now it's like at the very end of spectrum, is in severe arthritis, we can do something like fusion, just fusing the joint. The tail end of the solutions in terms of surgical options that are there. Yes.
I was looking at issues such as lifestyle changes or hydration change of diet. Can they play a role in treatment of ankle swelling and as well as the feet?
Sure. If we, once we do the diagnosis and we find the underlying problem is related to your lifestyle, like overweight, then we need to accompany all these measures that are addressing the current issue. We have to address the weight problem, encouraging you to lose weight, avoid inflammatory foods, and just be active. That will, again, reduce the amount of stress on your joints and in the very end, reduce the swelling around the joints. One particular condition that is quite problematic is usually what we call the gouty arthritis. And one common manifestation is around the foot. You find what we call the tophi. You have swellings that happen around the toes, then they burst, they release some whitish stuff, and people get a lot of pain around the joints. The other condition that has a lot of deformities on the feet and even the toes and the fingers is rheumatoid arthritis, SLE also. Those conditions also need to be managed by both the orthopedic point of view and also the physician or rheumatologist in order to control the inflammatory. And that controlling inflammation is both dietary and also medication-wise. Yes.
Right. And as we carry on, Dr. I think I see already a couple of questions coming through just in the theme that we are in. and we can address some of them. This one is saying, my left ankle and lower leg swells, and before the swelling would go away overnight after resting. However, the swelling is now kind of permanent, and after running tests, I was told I have lymphatic vein restriction in the lower limb. Please advise on how I can manage this situation, as the swelling is now permanent on my lower ankle.
When we, at the very beginning, we talked about some of the causes could be vascular. By vascular, I would say one of the common underlying vascular problem is related to, is what we call venous insufficiency, is that you have, the veins are not carrying blood effectively from the feet back to the heart. And this can be as a result of, again, some underlying inflammatory process, or over time because of what vocation a person is involved in. People stand for long, they would end up with valves that, you see, when the blood is coming from down back to the heart, so there are valves that prevent the blood from stasis, that's just collecting on the foot and effectively going back. And if you have those valves not working properly, then that would contribute to that. And the other thing is that, you know, we call the, around the calf, or the masquembe as we commonly call them, sometimes we call that like the second heart. The calf mechanisms helps pump blood back. So, and when you have your calves not very active, also can contribute to that. So what happens is that when the blood pools, these veins, they will eventually lose the integrity of containing the blood in the compartment, and then it seeps around. And the same if you have issues with the lymphatic systems, which is what carries all the toxic stuff back to from the systemic, so that it can be eliminated. Also, if you have the integrity of that, like it's leaking, so that will contribute to pooling of blood and all that lymphatic fluids, and it just collects around the feet. Most of the time, these are chronic conditions, and they need to be addressed from the point of what is the underlying cause. Is it that just you have what we call your valves are not functional, especially in the chronic venous insufficiency, or it's a lymphatic drainage problem? Then that would be addressed appropriately. There are some worm infestations that can lead to swollen limbs, what we call filariasis. You've seen people who have very huge, very big legs because of, especially in the irrigation schemes, and these are things that are carried by the transmitted by the snails and all that. So what happens when you have such infestation, that can also, it clogs your lymphatic drainage and the venous drainage, and then can lead to that. If as from what she described, is that initially it was almost what I said earlier on, like acute. It swells during the day, then when she rests, the swelling goes down. So probably at that point, if it was related to activity, from what I can gather, then one of the things that we would have addressed there is If you stand for long, give you some compression stockings, give you some exercises just to strengthen your calves and help that blood system going on. But now when it becomes chronic, then we have to do some studies, either venous Doppler studies that will show us the integrity of the veins, so that if you have now the weakness, then it will be addressed surgically and so forth. Yeah.
Right. And as we carry on, I just need to let you know you can keep sending your questions to 20933 on WhatsApp 0717 400 555. That is 0717 400 555 on WhatsApp, on SMS line 20933. Just bringing you up to speed that Hope Media, in partnership with World Serve International and Fiona Omondi of Women in Aviation Kenya, is reaching out with dignity kits comprising of sanitary towels, boxes, hygiene and grooming essentials for boys and girls in Korogosho. You're invited to be part of this impactful initiative by dropping off your donation in kind at Hope FM offices located at Sitam Valley Road. You can also send your cash donation via M-Pesa paybill number 933933, account Korogosho. Together, let's be the hands and feet of Jesus, because every child deserves dignity. For more information, call 0116 212 723. That is 0116 212 723, or email customerexperience@hopefm.org. A small gesture can restore dignity. Hope Media, keeping hope alive. And so, Dr. Let's look at more questions coming through, especially in relation to our theme of the day. This one says, I tend to get a spike of uric acid, which causes lots of pain and small swellings on my ankle, the right ankle and toe. What can be causing these sudden spikes? At times, it goes away without meds after a few days.
It's dietary related until proven otherwise. Yeah. So there are sugary foods, fatty, refined sugars, simple sugars, carbohydrates is one of the culprits. Alcohol as well. So you find we have what we call gouty attacks, and I think that's what he is experiencing. And I would advise, because he doesn't, from what he's explained, he doesn't seem to have a permanent deformity. The swellings come and go. So he needs to see a physician so that is good and taken care of. Get into medication that will control that, and also diet that will control that and will reduce the flares. Because what he's getting is flares from the gouty attacks. Yes.
All right. Another one here has shared a question on behalf of the brother, saying, my brother has an issue with the knee, looks like dislocation. He was not born with this, but when he went to high school, the knee began swelling. We did a scan and nothing was found. Then, now at the age of 21 in campus, my brother's knee keeps swelling, leading to waist pain, and one leg is longer than the other, and then the swelling started getting painful. The thing is, we have never understood what caused this, and we don't know the solution. Please, doctor, advise.
Kindly see an orthopedic surgeon. Yeah. As we said, anything that is chronic, has been bothering you, get specialized care. Yeah. But from what I gather, it doesn't sound like dislocation. Dislocation is usually acute, painful, and functional limiting. Yes. And anything dislocation is usually a surgical emergency. Yes.
All right.
Orthopedic emergency.
All right. Another one here. Quickly, we'll look at this one, who says, is it normal for my 6 weeks son to be making his legs stiff whenever I want to touch his legs? I usually massage him. Is it okay, or I'm doing I'm not doing a proper massaging, hands massaging or something. Yeah, 6 weeks son making his legs stiff whenever I want to touch his legs, and I usually massage him. Is it okay, or am I not doing a proper massaging?
It's part of the innate response and reflexes for children to do that, especially if you any sensation that is foreign to them, they will tend to respond like that. And especially if your hands are cold and all that, they will tend to stiffen up. But what I would advise is that make sure there's no anything abnormal about the joints and anything abnormal about the limbs. And if the child is actively moving the limbs when it's not being touched, nothing to worry about. Yeah. And massaging is quite okay. If you take your child to their grandmother and our mothers, part of what they do routinely when they wash is just stretch those joints, massage them. That is part of it. Makes the baby feel good. Yeah, and that I would encourage to keep doing that. Yeah.
All right. Another one here. This is from a lady, Josie, 42 years, saying, kindly help me understand why my legs are swelling under the ankle, mostly during the day, and after resting, they're okay. I got tested and my kidneys are okay. Also, my left shoulder is extra painful. I can raise my hand, but I can't sleep on that side for 5 months now. It's really painful.
For the ankles, I would like to gather more information. What are your day-to-day activities? Do you stand for long? Do you walk for long? Or are you sedentary, seated for long? What type of shoe wear do you wear? Are you on flat shoes all the time? Are you on high heels all the time? Those are some of the causes that if you have inappropriate shoe, constantly stressing your joints, what is our BMI? That is the other thing I would want to know. And do you have any other chronic underlying medical condition? For the shoulder joint, I would advise be checked. Any pain that is 5 months, as we said, any chronicity of symptoms, let it be checked by an expertise, so that can be we know what exactly their clinical examination and also investigation that should accompany that, so that we arrive at the correct diagnosis and advise on the appropriate treatment. Yeah.
All right. Another one here, I see one on Facebook. They're saying, I have a concern. I went through chemo, radiotherapy, and brachytherapy, I believe, brachytherapy last year. All my joints are paining. What could be the cause?
So part of the spectrum of cancer and also its treatment is that it causes a generalized body inflammatory process, and that is what is causing the multiple joint pains. So for now, I would advise working with the oncologist just to make sure she gets the appropriate anti-inflammatory medication, just to bring down the systemic inflammation. The other thing would be just make sure rule out any metastasis to the bones, especially if you have. She didn't say what type of a cancer she was being treated on. There are some cancers, they have propensity to metastasize or migrate to the bones. That has to be checked and ruled out. Yeah.
Okay. Thank you, Tabitha, for sharing that question, and thank you, Dr. also, for answering. I see another question here from a lady who is 56 years old, saying, do thyroxine medicine affect bones? I've been using the medicine since 1999 after radio iodine treatment for hyperthyroid. And asking that question: do thyroxine medicine affect bones?
So not quite, but there is a role of part when you look at the bone metabolism, and so supplementation. The thyroxine medication is just to supplement the thyroxine hormone, and that helps in bone metabolism, especially keeping in check the bone, what we call the bone homeostasis. That is, there is a balance of what the bone you're building and the bone you're resorbing. So the thyroxine will play important in maintaining the bone density alongside other crucial hormones. So I don't know whether she's implying effect in adverse effect or good effect. But thyroxine is important as well too, besides all the other body metabolism functions. Yes.
All right. I see another one here on Facebook, and this one is asking, this is John. John says, Daktari, could you speak to the issue of foot orthotics? I hope I pronounced it well. Foot orthotics as a conservative measure.
Orthotics is what things like insoles, things like medial arch support, and they are prescribed. Each orthotic is prescribed to a certain condition. A patient who has a flat foot, a patient who is suffering from plantar fasciitis and all that will use different orthotic. So before you use any orthotic, you need to see a specialist or either an occupational therapist or a physiotherapist, or to be recommended a particular orthosis that will help in that. Bracing also is part of the orthotic. It's just, it's devices that help support the bones or the joints in one aspect or the other, just to maintain function.
There's another one here who is seeking to know, hi doc, what causes pain on the back part of the foot? What causes pain on the back part of the foot?
The common causes what you call the painful heel syndrome or the plantar fasciitis, and the pattern of the pain is usually pain with bearing on standing, and it goes with rest. Most people will complain they have excruciating pain when they plant their feet after waking up. It's usually so painful. Then as they get to work, it eases. And anytime they sit or rest, and when they start working, then it becomes so painful. The other causes could be spurs and all that, but the commonest is plantar fasciitis, and it's usually a degenerative. In the past, they used to say inflammation, but then it's mostly degenerative. So if that is the kind of pattern he's talking about, then it's usually painful heel syndrome until proven otherwise. And it has that once the diagnosis is made, it's usually on clinical examination, then we can prescribe the appropriate treatment for that.
Another question here, I think it's kind of related to what you've just shared, saying, kindly niulizie doc, sensation kwa nyayo za miguu, I believe the sole of the feet, na mikono, nimepewa neurobion tabs, but hainisaidii, iko on and off for a while, and inafanya macho kuchoka.
When she talks don't know whether he or she, but when they mention that it's sensation, I don't know whether everybody has sensation because there are nerves there, so you have sensation. But when we have what you call abnormal sensation, like you feel like as if you're being pricked, what we call pins and needles sensation, or you have just you feel tingling sensation, or as if things are walking on your skin. Those are abnormal sensations, and there is a whole spectrum of causes for that. From metabolic deficiency or vital minerals deficiency, from compressive symptoms. Sometimes you have nerves that are being compressed, and that can contribute to that. Systemic inflammatory issues like diabetes can also relate to that. So I would advise, if it's something that has been bothering you for quite some time, then you need to be seen by a specialist. One, because we need to examine, take a good history, and then do thorough investigations before we just prescribe medication. But by now, most of them are just supplements, like vitamin B complex supplements. It's like a blanket. You're throwing just something, a blanket treatment, without actually addressing the particular cause for that. Yeah.
And so as we go back to the issues to do with swelling, feet and ankles, I'd like to hear from you, probably when it comes to preventative measures. What can somebody do in order to reduce the risk of developing swollen ankles and feet?
Proper foot care, and this includes proper footwear. Over 90% of non-traumatic issues that relate to ankle swelling and foot conditions would be prevented by that. So the recommendation is that wear shoes that are well cushioned and they are comfortable. Wide toe box, that when you wear your shoe, you don't feel your feet squeezed. And the kind of shoe you wear, it's well cushioned, meaning that meaning it's a rubber sole, 1.5 inch at the heel and 0.5 inch at the forefoot, so that when it balances your foot when you step the ground. The other thing is that for people who have underlying medical condition like diabetes, routine, one, have the particular condition well treated and under control. If it's rheumatoid, if it's systemic, gout, if it's diabetes, let it be well controlled. Number two, there are what we call routine foot checks. When you go to any diabetologist or endocrinologist, they have the way they test the sensations. Because, again, what we said is that you want to have a normal, sensitive foot to prevent trivial injuries that you're not aware of. And diabetic foot ulcers is such a common issue and difficult to treat for the diabetics. The other thing is that if you are a sporty person, I can't emphasize this. Proper shoe wear. If you want to run, get the proper shoes. That will prevent a lot of spraining and trivial ankle injuries, especially if you are running on uneven grounds and all that. And always, the athletes, they have coaches who help them train them on how to make sure your feet are planted well if it's like the high jumpers, the long triple jumps, and those who run. How do you run? It's usually not just something that you do. And if you look at some of these professional athletes, the kind of shoes they wear, they are shoes that are manufactured with precision to that kind of activity. So if you look at, and if it's football, again, the same thing. You don't go to run with your office shoe or your kawaida loafers and all that. So get the proper shoe wear. That will prevent a lot of your ankle injuries. And the other thing is that always seek medical attention for anything that you're not, for any condition that concerns you, and as we alluded to earlier on. Yes.
Now that you've touched on athletes and all, and even apart from those who are athletes, would you recommend some certain exercises that would help us stay healthy when it comes to maintaining healthy circulation of blood? From as you put it, at times the blood would want to come up and all the circulation.
Yeah. So calf strengthening exercises. These are some things that anybody, if you've attended any gym instructors can give you a set of calf strengthening exercises. As one of the simplest is you stand on a stair with just your feet, your toes just touching, and you're supporting yourself. You can stand on you tiptoe, then go down all the way. Those are simple exercises, bodyweight exercises that you can do. Things like plantar stretches, whereby you get a simple a ball of tennis and you roll it on your barefoot. That also helps just stretch, especially for the people who have painful heel syndrome. That will help. Or something like that looks like a rolling pin, the one that you use in the kitchen, and roll it on your foot. That helps stretch your the intrinsic muscles and the plantar fascia. And the other thing is, I encourage people to walk barefoot occasionally, as it can allow you, especially on the ground. That grounding helps what we call proprioception. And as much as there is the role of what you call the earthing, that controlling the inflammation in the body, there is also the role of proprioception. And that's why whenever I meet in our setting, mothers to children who are worried about the child having a flat foot and all that, one thing is that I discourage them to have their children on full-time shoe wear. Children are supposed to your feet are actually supposed to just be free. Proprioception, let it get used to the ground. That improves your gait, how your foot responds to the joint reaction when you're walking. Have them, and then it strengthens also your intrinsic muscles. If you're quite dependent on just put always on your shoes, then even the plantar skin is soft and it's not hard. You're prone to injury and all that. So that's the other thing I encourage people to do. Just walk barefoot. You can say every Sunday, sometimes in the day, just walk on the grass barefoot. That's what we were meant to. That allows your feet to breathe, feet to get contact with the ground, improve proprioception. Proprioception is how your body interprets a joint in space. So that helps mitigate trivial injuries whenever you're walking, and it improves your foot biomechanics by far.
Wow.
Yeah.
Learning a lot tonight. And this is the time, Dr. Then you can give us your parting shot and then let us know in case a listener wants to get in touch with AICQ International for more information or assistance. You can also add on your parting shot.
Well, I would encourage people to be very intentional in taking care of their feet by the kind of shoes that we wear. Your typical 9 to 5 shoe that you go to office with, it's not the best. It's not ideal. The ideal shoe should be a white, not the sharpshooters that you're used to. You keep your feet squeezed and tight, and that always lead to problems. The ladies have that when they put on high heels, narrow toe boxes, they get deformities on their feet, pain on the heels. It's chronic, it's common. And by just those simple preventive measures, you can address most of these foot problems, and you won't need to see a doctor. And always use the appropriate shoe for the kind of activity you're going to do. If it's walking, if it's jogging, if it's the shoe, take care of your feet, and you will not need to see a doctor any day. To see us, ACQ, I think we have our social handles and online presence from our website and all that. Physically, we are located in Kijabe, that is in Lari Sub-County, in Kiambu County. We run clinics from Monday through to Friday, and you can always, if you have any questions, you need to see a doctor and expert consults, we're always there to give you the expert advice and also the intervention that you so need as, God helping us. Yes.
Thank you so much, Dr. Maluki, for coming through. And send our greetings to the rest of the team there at QA International.
Sure.
Looking forward to yet another session next month. Should be next month. We're going to handle another subject as well. Thank you so much.
All right. Thank you for having me.
You're welcome. Well, that's just about it tonight on this particular session that we were looking at issues to do with swollen ankles and feet, and helping us was Dr. Brian Maluki from AICQ International. Stand by for the segment from the scriptures, and then we'll have reflections at 9:15. At 9:30, we pray together on Prayer Focus.
Hi, this is Carol.